Good afternoon, everyone. Thanks for joining us for this, our first COVID-19 press briefing of the week. Today, Orange County Mayor Jerry Demings will discuss our goals for the week. The mayor will also give an update on COVID-19 testing at Barnett Park and our positivity rate. The mayor will also discuss the reopening of the portal for vaccinations here at the Orange County Convention Center and reveal details on the upcoming Emergency Rental Assistance Program. Mayor Buddy Dyer could not be here with us today. We do have, however, from the Florida Department of Health in Orange County, epidemiologist Alvina Chu is here to discuss testing and vaccination details. And we have a very special guest with us today as well, Dr. Alric Simmons, Chief Health Equity Officer at Advent Health. Mayor Demings will have more on the good doctor in just a few moments. I know your questions, ladies and gentlemen, will be abundant. However, please only one question in this portion of the press event. All presenters will remain for additional questions after we are done. We begin this press event with Mayor Demings. Mayor?
All right, thank you, Dr. Williamson. Thank you to all of you for being here. Hopefully you had a great weekend. We do have quite a bit to go over with you. Today marks the 111th time that we have done a press briefing regarding our efforts to respond to the novel coronavirus within our community. The United States is closing in on a grim milestone. The Center for Disease Control and Prevention predicts that a total of 500,000 individuals will have died soon from the COVID-19 virus. And so here in Orange County, we have 1,072 residents who have succumbed to the virus. So what I'd like to do is to our community to just pause for a moment of silence in memory of those who have passed. Thank you. Despite the number of cases that we are seeing a slowdown within our community. We are continuing to administer the vaccine, and that really underscores the need for us to continue keeping up with the safety protocols that have been suggested by healthcare professionals and the Centers for Disease Control. The coronavirus still poses a grave threat, and we must not grow lax as we work to prevent further illnesses and deaths. So my goals for this week continue to be similar to what they are each week. Number one, we will continue to extend free COVID-19 testing for another month at Barnett Park. I'll talk more about that in just a moment. We will continue to work to get the vaccine out to senior living communities, churches, and other places within our community as soon as we can. And number three, we will continue to assist the Department of Health in getting the vaccine into the arms of more of our residents at the Orange County Convention Center. As I mentioned, just some good news here is that we will keep the Barnett Park open for free testing through March the 31st. As you all know, we had said that we were intending to close that testing site at the end of this month. However, we're going to keep it open through at least March the 31st. Again, this site is run by Orange County Health Services, and it is free to anyone seeking rapid or PCR testing. The park is open for testing 7 days a week between the hours of 9 a.m. and 5 p.m. Now let me talk a little bit about the portal that we opened this morning. This morning, the portal for vaccine appointments opened at 9 a.m. for the Orange County Convention Center. All 6,800 of the appointments were booked within 2 hours. We opened at 9 a.m. promptly, and by 10:58, all of the appointments had been taken. So if you have a confirmed appointment and do not have a means for transportation to the convention center, you can call our number 311 for assistance, or you can dial the full number out, 407-836-3111. That is if you live within the jurisdictional boundaries of Orange County. An operator will coordinate with links for a possible free transportation option. Links tells me at this point they average 4 or 5 people who take advantage of this each day. There must be a 48-hour advance notice if you choose to use links to get to the convention center if you fit the criteria. Today, the Orange County Convention Center site increases capacity to 3,000 individuals a day. And at this point, nearly 46% of Orange County residents age 65 and older have been given at least 1 dose of the COVID-19 vaccine. Countywide, nearly 8%. The Department of Health tells me the number is 7.89% of our total population has received at least 1 shot. That equates to 116,496 individuals. So let me just say thank you to all of those who've been working at our convention center with fire rescue, the paramedics, as well as the other healthcare providers, the Department of Health, and those from health services working to make that event a success at the convention center. Also want to applaud our paramedics. Orange County Fire Rescue paramedics have now provided 4,600 shots for seniors. This is where we are going into the community to administer the shots where the seniors are living. So kudos to our firefighter paramedics. Since the start of the pandemic, there have been a reported 112,161 COVID-19 cases in Orange County. Our 14-day rolling positivity rate is now 6.3%, so it has declined significantly since the holidays. Again, 1,072 of Orange County residents have died from the coronavirus. That is an increase of 12 deaths since our last briefing this past Thursday, and we will have Ms. Hsu talk more about the data from the Florida Department of Health in Orange County. As a reminder, just 1 week from today, March the 1st, we will launch the Orange County Emergency Rental Assistance Program. As you know, our former eviction diversion program ended this past Friday. The new program has more than $33 million in federal funds to help with rent assistance for predominantly low-income residents. More information about the Emergency Rental Assistance Program, including eligibility criteria and required documents, will be posted online later this week on our ocfl.net/ERA is the web address. Residents that are in immediate need for housing resources can call the Heart of Florida United Way's helpline also to receive additional resources, information on additional resources by dialing 211. And at this time, I'm going to ask Ms. Alvina Hsu, the epidemiologist from Orange County Health, to come forward and share some additional information with you. And Ms. Hsu, you're recognized.
Thank you, Mayor. Thank you. As the Mayor had mentioned, we've had 112,161 positive cases reported to us since the beginning of the pandemic. Our current recovery rate remains at 96%, and the 14-day rolling percent positivity rate is 6.3% based on positive and negative PCR lab results. Unfortunately, since the last time we spoke, we've had 12 deaths reported due to COVID. The age range is from 35 to 96 years old, with a median age of 81.5. We send our thoughts and prayers to the families and friends of those who we've lost to the virus. Of the 12 deaths, 4 were female, 8 were male, 1 was Black, 1 was Native American, Native Hawaiian, Pacific Islander, 9 white, 4 were Hispanic, and 8 were non-Hispanic. 7 were known to have underlying health conditions, and 5 had no known underlying health conditions. The dates of death, 8 of them were from February recently, 3 dates were from January, and 1 date of death was from December, which has since been transferred to Lake County. So our total for after that jurisdictional transfer would be 11 deaths. The COVID variant cases reported in Orange County remain at 14, which is the same as the last time we spoke. For the vaccines that we're providing to try to help protect us from the pandemic and try to get this under control, we've had 212,000 doses, over 212,000 doses administered. To residents of Orange County, we had 186,163 doses, and at least 116,496 Orange County residents had at least one dose. 45.7% of Orange County residents 65 and older have been partially vaccinated, so have received at least one dose of the vaccine. We'd like to remind you, if you have any unwanted vaccine appointments or if you have received your vaccine from another location, please go to the portal where you made your appointment to cancel it so that we could get that vaccine to another person. And you can go to the patientportalfl.com, click My Vaccinations, and cancel from that screen. And as a reminder, while we're going through this vaccination effort to try to increase the community immunity here in Orange County, please practice pandemic precautions, as we've mentioned, to protect us who have not yet been vaccinated and those who cannot be vaccinated. And so the pandemic precautions, as a reminder, are to wear a mask, watch your distance, and wash your hands. And I'll be happy to answer any questions, and I'll turn it over now to Mayor Demings.
All right, thank you, Ms. Yu. One of the things that is really important to our community is to get more vaccine supply here and get it out into as many different neighborhoods as we possibly can. For many people, there's some concern about whether it is safe to take the vaccine. So what we have done today is we've asked Dr. Simmons to come forward and share with you some information about vaccine hesitancy as well as healthcare equity. And as he comes forward, I want to share some additional information with you. Dr. Aldrich Simmons is Advent Health's Chief Health Equity Officer. The National Institute of Health has recognized Dr. Simmons as a National Health Disparities Scholar. He led Advent Health's relief efforts following the Haitian earthquake and hurricane response teams in the Virgin Islands and in Freeport, Grand Bahamas. He is a practicing surgeon, and prior to taking on the Chief Health Equity Officer role, he was Chief Medical Officer at Advent Health's East Orlando location. He also holds that position now at Advent Health Celebration. So he does double duty, it sounds like to me. And so without further ado, I'm going to turn it over to Dr. Simmons to share some information with you. And after he concludes, we will then open it up for the questions from you in the audience.
Thank you, Mayor Demings. Appreciate that. I think, as you mentioned, doing double duty is something that many of us in healthcare are doing through this pandemic. There are many folk who are doing 2 and 3 jobs, and so I just lean myself into that with everyone else. What I really want to address today is the level of hesitancy around getting vaccinated. And it is clear to almost every medical professional that this is the way forward for us to get out of this pandemic, to get back to life as we know it, to get back to travel as we know it, to get our economy back in order. And there are several different groups of people who are hesitant to be vaccinated. Some of them are afraid. We've heard a lot of things around the trust of the community, particularly those who are African American and Latinx, who have longstanding memories of atrocities that have been committed. And what I would say is that this vaccine, the Moderna and the Pfizer vaccine, and probably soon to be the Johnson & Johnson vaccine, have been vetted and are very, very safe. So I would hope that as a medical professional, representing a body of medical professionals and nurses and allied health professionals, that assurance from the same people that, God forbid, you get COVID-19 and end up in one of our care facilities, that all of your providers have already been vaccinated. If we think it's safe enough for us to take, we certainly think that it is safe enough for you to take. Another voice that we hear from the community is that around the time, the speed of which these vaccines were prepared. It seems like it came to market in the middle of this political hellstorm, and a lot of people distrust it because of the speed, the rapidity of which it became available. And to that, I would offer this. The research behind these mRNA-related vaccines has been going on for greater than 30 years. It is that 30 years worth of sunk work that has allowed these messenger RNA vaccinations to be rapidly ready and to, in fact, actually be modifiable to some of these variant strains that we're starting to see now. And so, again, please don't let fear, false evidence that appears to be real, the thought that these vaccines are now new and because of the speed with which they were prepared, hinder you from protecting your life and the life of people that you love. And then the other group of patients that we see who are reluctant to become vaccinated say they just want to wait and see. They want other people to get vaccinated, and then they want to see what happens to those folks. And to those patients, I would say, or citizens, I would say, we understand your hesitancy. Your medical providers are available to discuss the reasons behind your hesitancy. But at the end of the day, each day that you wait is playing Russian roulette with a vaccine that is no smell, no touch, and is lethal. And so please make the responsible decision, the best responsible decision for yourself and your family, and get vaccinated.
Okay. Thank you, Dr. Simmons. At this point, we'll open it up to questions, but let me just also remind you that if there are questions from the school district, Mr. Scott Howard has joined us here today, compliance-related issues. We have Mr. Tim Boldick here in the audience. Any issues related to some of the planning efforts. We have our Public Safety Director, Mr. Danny Banks, that is here. And we also have two of our county commissioners here, Commissioner Maribel Gomez-Cordero and Commissioner Myra Uribe have joined us as well. So with that, we'll open it up for any questions that you may have from Dr. Simmons or of Dr. Simmons or Ms. Hsu or myself at this time.
I'm shocked to be going first. I'm sorry, Lauren. Danielle Lama with Fox 35, Mayor Demings. With the flow of vaccine is stronger now coming into the county. We also have the federal site that'll be up and running in a couple weeks. You had mentioned a little bit last week about possibly adding the eligibility. Have you heard anything new on that? Will there be new groups that will be able to get the vaccine in the near future?
There's been no decision at this point to add additional individuals to the eligible group at this point, but that certainly will change, I believe, soon as the supply increases. I had the opportunity to speak with the Florida Department of Emergency Management Director, Jared Moskowitz, last week, and he reassured me that he would be working with the federal government as well as those here within our local community as we identify additional sites for distribution. There will likely be, in addition to the federal site that will be set up at Valencia College in West Orange County, there will be some mobile units that will be set up that will be used to be deployed here in the area to ensure that we are reaching some of those most vulnerable, underrepresented populations here within our county. Okay, Mike has moved somewhere.
It's over here.
Oh, there it is.
Yes, this is Nikki Zizaza with News 6. I have one question for both Dr. Simmons and Ms. Hsu. Same question. For weeks, in these conferences, you guys have been really pushing this racial disparity as it relates to the hesitancy within the minority community of getting the vaccine. There have been the mobile pods that have been going into some of these areas where there has been instances of hesitancy. So what's the progress in that in terms of what does it look like now? Several months ago, this was an issue. What is that looking like now?
I'll take a stab at that one. So that's a very pertinent question. And I think that as time goes on, what we've seen, we've actually done a large study at Advent Health looking at patients of Advent Health, looked at about over 100,000 of them and asked them specifically about their reluctance or hesitancy to get vaccinated. And what we've seen across all demographics, whether you split that out by age, by gender, or by race, that there has been an increased adoption of vaccine. And so we think that as time goes on, specifically in these underserved communities that we really have been ravished by COVID, we think that we will get some traction continuously. And the reality of it, I think, of those communities, they know people who have died of COVID, they know people who've been in the ICU, and so they get it. And I think that a lot of it is fear that is holding them hostage. And as they see that this vaccine is safe, when it is distributed in scale, I think they become more confident themselves, and they will get vaccinated over time.
I'm glad you brought up the thing about a lot of the communities have seen the more severe outcomes from this disease. And so what we've been working on very, very diligently with our Orange County partners and also our community health partners is to create the mobile distributions teams to go out into locations where perhaps there's lack of resources or lack of access to resources such as transportation or internet access. And so as the mayor had mentioned previously in his comments, I believe it was over 4,600 doses have been given in partnership with firefighter paramedics, and this is us in partnership with the Department of Health with us to go out and identify the communities. And so we've created a prioritization index based on social vulnerability, the CDC's social vulnerability index, also percentage of the population there that has not been vaccinated yet, and then also including the rates of death due to COVID so that we can really target where the vaccine really needs to go. Thank you.
Okay, this is Melissa Thomas of Florida National News. This is actually a compliance question. So I did want to ask, given the increase in vaccinations across Orange County, have you guys seen a decrease in the number of cases of compliance violations? How has the vaccine affected that across different businesses?
That's a good question. What we've been seeing is I think we've gotten better in terms of compliance, not as many warnings or citations out there. So I think that it's been a good thing from the vaccine. Certainly not a time to let up, and we certainly want to make sure that people continue to adhere to the mandate, the executive order, and wear your mask, wash your hands, and keep your distance. So we'll make sure we'll keep out there and make sure that we keep following that.
Hey, Eric Mock, Spectrum News 13. This question is for Dr. Chu and Mayor Demings. So the health department tweeted about 10 a.m. about that there were like 400-something appointments still available, for the vaccines. But then you talked about how in 2 hours it was closed up, but I know before it would close in, minutes. Are we seeing a drop in the demand for seniors wanting to sign up for appointments to get the vaccine? And if so, is that causing you guys to kind of push more for the state to open it up to other demographics?
You can take a first stab at it.
Also, it's Dr. Simmons and Ms. Chair. Thank you. I defer to the mayor about, as you mentioned, about the prioritization. So I don't think we've seen a decrease in the demand from our population for these vaccines. I don't have anything specific.
I guess the only thing else that I would add is at 46% of the 65-plus-year-olds who live in our county have been inoculated at this point. I think the more that number goes up, then obviously the less demand you're going to have. Think about it in this way. We're only at about 8% of our total population in Orange County. If we were at 46% of our population that had been inoculated, who included those under 65 years old, there would be less demand. So I think that naturally, the higher the percentage goes up, the less demand there will be, which means that at some point, from a planning strategy, there will have to be an adjustment. We still have a significant ways to go to get the 65-plus-year-olds inoculated, and we're doing everything that we can. As the supply increases, you're going to see supply where hospitals will continue to provide inoculation to their patients. You will see our community health centers come online very soon. Some of them will begin to receive shipments, I think, this week. You will see other locations. You'll see some of the mobile pods or the pop-up sites that will be available in our community. At this point, we're only limited by the supply, but we have detailed plans of how, once the supply increases, we can get it out into the community. So I think it's a function of a couple of things there. We're offering the free rides. We're going into their homes. Even, in fact, here very soon you're going to hear about another program where we will expand our reach into specific homes where individuals would have been identified who cannot leave their homes for whatever reason and be transported to the convention center. So we're going to take this effort into their homes.
Well, now you brought that up. So what is that effort that you're referring to?
What is the number?
No, that effort that you just
The effort. It's going to be an effort, again, where we will work with the Department of Health. We'll be working with our paramedics to identify individuals who cannot leave their homes for whatever reasons, for health-related issues. And we will go into those communities to, again, ensure that we are addressing some of the health inequity challenges, if you will, that we see that has happened not just here, but all across America. So the data that is being collected by the Department of Health allows us to look at the zip codes, allows the Department of Health to look at the zip codes, and we can make modifications and adjustments.
Amanda Dukes with West 2 News. Dr. Simmons, this question is for you. One hesitancy I've heard is someone might hear, you know, my neighbor got the second shot and he really didn't feel well after. He was in bed for a day. And I've been frustrated trying to explain to people, you're not getting COVID from the vaccination. So from your perspective, can you explain what happens in our body that can perhaps make us not feel well and why we don't need to fear that we're actually getting some degree of COVID?
That's a fantastic question, so thank you for the opportunity to explain that. You know, when you get vaccinated, your body is getting exposed and an inflammatory response is beginning to set up. Your body has the ability to literally have a memory existent in it. So when it sees, for these mRNA vaccinations, specifically the spike protein that the COVID or coronavirus binds to the lung with, it has the ability very, very rapidly to mount an immune response to prevent the progression of the disease, to prevent you from perhaps needing hospitalization and certainly from needing ICU care and ventilation. That should not surprise anybody. And the reason that should not surprise anyone is that both Pfizer and Moderna and the CDC and the FDA and even Advent Health's internal vaccination task force have reviewed the data, and they were very, very clear about that when they got their EUA, saying that the side effects were more likely after the second dose. They are largely joint pains, fatigue, headache, and most of them resolve within 24, 48 hours. I myself, when I received my second dose, felt very, very tired. The next day, I felt fine. And I think that is the course that most who get vaccinated, if they have an event, that is what it will be. I have not, to my knowledge, other than the other thing that they talked about a lot as well was local site pain at the injection site and maybe some redness and swelling there. The community at large should not fear that. I would take any of those symptoms other than being in an ICU on a ventilator and being socially isolated and perhaps dying any day of the year. And I think that's what people really have got to start looking at. When you heard the epidemiologist earlier today talk to you about the people who died in the last several days here, people are still dying of this disease, and getting vaccinated really and truly is your best line of defense, in addition to all the other social distancing and hand washing and the like measures that we've been doing for a while.
Lauren Seabrook, Channel 9. Dr. Simmons, you made the comment, if it's safe enough for me, it's safe enough for you. And I think one of the things that I hear often from people is that they may say, I know a nurse who won't even get the vaccine. So I'm curious, what level of hesitancy are you seeing within employees of Advent Health, and what are you all doing internally to increase that?
So, every employer, their workforce, their human resource is a valuable resource, right? And it is a microcosm of the communities in which we live and exist. And so the same issues that you see broadly in the community, to some degree, you see some levels of that hesitation as well within our staff. We are actually now tabulating to see what the allocation of employees who we've been able to vaccinate, what they have been based on a racial profile, to make certain that if there are special groups that we can spend time dialoguing with them, encouraging them to get vaccinated, and understanding their fears. And I think that's the piece that we've got to really focus on, is how do we bridge the gap between fear paralyzing people from making a right decision and then getting them to the point of education where they understand that this is safe and it is the right thing to do. It is a bit detrimental, honestly, when you hear about a healthcare professional and they boldly assess, I haven't gotten it, because the reality of it is that as healthcare providers, people look to us on the side of the soccer games. The moms and dads ask the questions to the healthcare providers in the grocery store. They stop you and they ask. And so when you hear that from a nurse or a physician, it does kind of set back that issue. But I think that as we continue to educate, as we continue to deal with the fear that is paralyzing people, hopefully we'll get all nurses, all docs, and all of the society to get vaccinated.
So along those lines, Dr. Simmons, sometimes we see and hear various individuals who purport themselves as medical experts who are advancing different beliefs that there's over 4,000 different variants out there and you can't stop it. How do we respond to the public about what we do know about the vaccine and its efficacy to be able to stop the virus?
I'd say a couple of things to that, Mayor Demings. One is that the public has done a great job of educating themselves. I was commenting to someone earlier today that it is amazing. I saw patients earlier this morning, and patients were coming in asking me about mRNA. I've been in practice here for almost 16 years. I've never heard a patient come in and ask about biological or virology type of things. But I think that is because of this distrust and this gap, this chasm that is there between what they see and what they're attempting to process on their own, and in the lack of an intermediary like myself to be able to say this is what it is. They are attempting to grasp large amounts of information as rapidly as they can. And unfortunately, YouTube and some other places, social media sites, are filled with folk who are not necessarily perusing, reading, studying, and dissecting the data in the manner that we are. I will tell you, I'm very, very proud to lead a group of 26 healthcare providers as part of a scientific research committee, and we pore over this data at least twice a week. And have been doing so for the entire pandemic. And so I feel very, very comfortable as I stand here before you saying that the science behind vaccinations is very, very solid. And, the things that people are afraid of, they can read. They can read it in the EUA. Pfizer's is a public domain. Moderna is a public domain. You can read all of the things that I'm telling you about the vaccine. The question is, will they trust? And that's the bridge that we've got to get to.
This next question comes in from Shannon Butler in WFTV for Alvina Chu. Her question reads, did we receive delayed shipments of vaccine from last week? Can you update us on the vaccine shipments here to Orange County?
I believe Dr. Pino had mentioned this on his Thursday press conference, that we were not part of that delay.
This next question is from Steve Hudak in the Orlando Sentinel for Mayor Demings. His question reads, where will the FEMA satellite locations be located? Where would you like to see them?
I have a call this week where I will be meeting jointly with some of our state legislators who are concerned about health equity issues. They will propose certain sites. I will communicate, at least my staff will, with the state Department of Emergency Management and our federal authorities to identify sites that make sense for us to be located within in order to increase the number of individuals who are being vaccinated.
This next question comes from Michael Daly from the Daily Beast. Mayor Demings, and this is geared towards the strike teams. Can Orange County commit to checking the CPAC gatherings for mask compliance, given that it will be sure to include a number of anti-maskers? That would include Sunday afternoon when the former president is slated to speak here in Orlando.
We have a mandatory facial covering order here in Orange County, and we want compliance with that order. As we plan to reopen business here, you may recall that we had an economic recovery task force that we put in place. It had representation from our hoteliers and others who committed to certain plans of actions and certain guidelines as they reopen their businesses. I have had recent conversations with hoteliers who will be hosting the various patrons who will attend the CPAC conference here in Orlando. They have assured me that they intend to make it a safe environment for their guests and that they will follow the guidelines. If we receive complaints, just like we do with any other types of businesses, our compliance teams will be dispatched to do inspections of those locations. Those hotels surrounding the primary host hotel, I believe is the Hyatt, our inspection teams have been in those locations historically and done inspections, and there is nothing that says they will not go back and do inspections.
Thank you. This next question comes from Nadine Yanis from WKMG. For you, Mayor Demings, what have the conversations been like with the White House in regards to bringing federal sites to Orange County?
Obviously, there's only 4 designated federal sites within Florida at this point, and we have one here in Orange County. I believe that Orange County was so designated because we're central to the state. We have demonstrated our ability to work collaboratively with all levels of government to get the job done. So I believe that that's a plus for our community. We were one of the first communities to offer up our convention center as a regional testing site, and it has remained open now for nearly a year. And we have volunteered our convention center site as a regional vaccination site as well. And so we're going to continue being an advocate for the people who live here, that they receive the vaccine that they are interested in receiving. So the demand at this point far outpaces the supply that we have in our community. The supply is controlled by the federal government. So we will use our relationships with our federal elected officials and our state elected officials to be successful in getting at least our fair share of the vaccine that is available.
This next question comes from Hadass Brown from WESH. For you, Mayor Demings, what is your take on when those who work in Orange County's hotels should be able to get the vaccine?
Some people, obviously, in our hotels have likely already received the vaccine. There are a number of, I think, groups that should receive a fairly high priority. Obviously, those on the front line, the healthcare workers, the law enforcement and other first responders, firefighter, paramedics have not yet been vaccinated, and they're working in the field dealing with this every day. Our teachers, you heard us say last week, we thought that teachers needed a higher priority. And then I will say those who are most vulnerable, those who have health-related issues that compromise their immune systems, et cetera. We like to see the eligibility criteria modified as the supply expands, so will the eligibility criteria. And so I think that we're not months away from that happening. I think we're just weeks. We should see some modification occurring.
And last question, this is for Mayor Demings and maybe Director Danny Banks. This comes from Ryan Lynch in the Orlando Business Journal. His question reads, with the Valencia College campus getting a federal site and the site at the convention center, where do you expect the next large-scale vaccination site to be placed in the county? What might that look like?
Well, with the mobile pods, the Valencia site is kind of like a holding site, but with the mobile pods, they expect those pods to be able to be deployed geographically in other areas near our county to serve underserved communities that may be on the border of another county. But we certainly would like to see the ability to do more vaccinations in East Orange and for me in Northwest Orange, to also even Southwest Orange. So we really want to see the total numbers increase significantly. Now, you know, the pharmacies soon will be an increase in the number of vaccinations they will be providing. That is a federally run program. So what we try to do is each week, several times a week, my staff and or I are on those calls with the White House officials or other federal officials or state officials trying to facilitate the dialogue about how this is going to occur. So we have here within the county a daily conference call with our healthcare providers, our major healthcare providers, the Department of Health in Orange County, to have conversations about what that looks like. Every couple of weeks we have a joint call of the neighboring counties, Orange, Osceola, Seminole, and Lake County. We do a call to try to facilitate conversation and dialogue about what's in the best interest of the entire region. So I just want our public to understand that we are being very intentional about that which we can control. What we can control at this point is our level of preparedness to be able to assist with the distribution of the vaccine. We cannot control the vaccine flow. That is controlled by the federal government. Okay. Well, I think we have covered it. Let me just say thank you to Dr. Simmons for coming today and being put on the spot. Thank you to Ms. Hsu for always coming. And lastly, let me just say thank you to our American Sign Language interpreters. We do get a healthy amount of feedback from our hearing impaired about the quality of the interpretation that they do here. So thank you to our ASLs. Thank you all for joining us. Our next press briefing is Thursday at 4:30 p.m. Thank you.